Good evening, good afternoon, and good morning. All of you know that the International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. And from 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself, so that those who misses the session can watch it again. You can subscribe the same to your homeopathic lovers as well as the students and doctors. The purpose of this forum is to take homeopathy to people around the world, all over the world. Let me come to today's guest. And today our guest is Dr. SURJIT Singh MAKKAR, who has completed BVSc and H, MSc IT, MCA, and M.F. London, and has done advanced certificate in AI for digital health and imaging, IISc, Bengaluru. And he's a member faculty of Homeopathy Malaysia and DTS, that is Direct Trainer Skills. And he is the former Joint Director, Punjab Veterinary Homeopathy Visionary, integrating holistic practice with the latest advancement of artificial intelligence in digital health and imaging. An internationally acclaimed consultant and researcher. So today, Doctor has presented so many sessions in this forum, and we'll be talking about integrating artificial intelligence and homeopathy in veterinary clinical practice. We are proudly guest faculty, Dr. SURJIT Singh.
Thank you, sir. So I'm audible?
Yes,
Sir, you are audible, sir. You are audible.
Okay. Pranam, sir, to my senior sir, Dr. Sani, sir. Pranam, sir.
Thank you, sir. Thank you.
Start good evening, very good evening to everybody. I'm just going to start my sharing of the screen. Just 1 minute, give me 1 minute. 1 minute, 1 minute, 1 minute.
Not visible, sir.
Uh,
Please reshare. Stop sharing and restart.
How to do that?
First, you stop the screen sharing and then restart sharing.
Share screen, no?
Yes, sir. On the
Yes.
second part, there is a share option in green.
This share.
Yes, yes. Now it is coming.
It is coming now?
Oh, it's clear. It's clear.
Okay. Good.
It's fine. It's fine now. You can make it big one. No, full screen option. Oh. No problem, sir. You can start your session.
It is visible now?
It's visible. It is the first stage, integrating artificial intelligence and homeopathy in veterinary clinical.
But to me, it is not visible now. Problem is again.
No, you may not be able to visible, sir. That is the kind of, you can see in the laptop. Try to move it, sir. Try to move it. I shall see whether it is moving or not. Let me see. No, it is not moving. So it is stuck, sir. It is stuck somewhere. So you may close once again and restart sharing so that it will be okay. Once again, you can.
But it is seeing me more and more, but what happened?
It is not moving, sir. Maybe sometimes that may happen.
I should go again, go for stop sharing and then sharing it
Yes,
happen?
exactly. You may stop sharing and restart. Then
Yeah, restart. Yes, yeah. I have to do like that, no? Yes. So it is moving or no?
It is not moving. It is still on the first page itself. Yeah.
But it becomes big now?
Yes, it comes. Try to move it, sir. Let me see the second slide comes or not.
Yes, it is working now.
No,
yes,
it's okay.
Yes.
It's okay now. It's okay. You can, fine.
So, thank you, my seniors. Sorry, due to some network problems. So, as you know very well, homeopathy is a system of medicine discovered and developed by late our Dr. Samuel Hahnemann. So, this is Dr. John Martin Honeyberger, which was the first person who is recognized to have about homeopathy and the name of Hahnemann to India. So, Dr. Honeyberger arrived at Lahore in 1829-30. The then ruler of Punjab, Maharaja Ranjit Singh, was impressed by him when he treated his favorite horse of its for bad leg ulcers. So this is how Dr. Honeyberger has introduced veterinary homeopathy in India through Maharaja Ranjit Singh's time. So this is a history saying he has treated his horse for this bad leg ulcers. So this is the existence, this is history now. At that time, there was a more or less over everything was horses only. Okay, they are the prime animals through which you can fight your this battles and like that. So it was a major thing that was being treated by Dr. Honeyberger. So as you know very well, the major principle is homeopathy, like treats by like. So what is homeopathy? It is a medical approach that respects the wisdom of the body. It is an approach that utilizes medicines that stimulate the body's own immune and defense system to initiate the healing process. And this is very, very important. So we are dealing with all type of animals. We are dealing, well, you human doctors, you can say that you are dealing with only a human being. And we are dealing lot of species, right from sparrows to elephants. We have every type of patient. So sometimes it is again, sometimes it's problem because you take the section of dogs only. So there are more than 400 breeds of dogs only. You leave the cat part. Again, in cat, there are a lot of breeds in only one species. Dog is one species only. That is comes under canine section. Okay. So, and this cat comes under feline section. So this is at one time there's a cat also. At one time there's a lion also. Lion is also feline family. So as you know, we have to treat every type of case. So first we have to know how to observe the animal. That is the main thing in veterinary case taking. So every time we have to case the take, how to take the case. This is the main thing in veterinary homeopathy. So it is an approach that individualizes medicine, yes. As you know very well, homeopathy is an individualistic medicine, and we give everybody by taking its mind symptoms into account. First, we take the mind symptoms into account. Second, we take PQ or SU symptoms, that is peculiar, cure, rare, uncommon symptoms. Then we take the constitution of the animal. So this is how we proceed forward with these things only. And we follow the principle of LACM. This is taking the veterinary case. So every time we have to find the totality of the case. We have to find the simillimum. That is the main thing, as you know very well in human beings also. Every time we have to find the totality of the symptoms. And with the help of artificial intelligence, we are covering this part very, very easily, because when we feed a lot of symptoms, these rubrics, there's no need of writing rubrics also, but use of feed symptoms only. And through AI, through machine learning, you will come to know there are so many equations and there are so many languages like Python and R, through which we can learn how to extract the data from a particular, from the whole web of the world, you can say like that, whole internet around the globe. So this is the beauty of the artificial intelligence, that we are utilizing this artificial intelligence in veterinary homeopathy. And most probably it is predicting us these patterns. Artificial intelligence is best in predicting patterns. It checks all the historical data. It makes the patterns as a available source of history, and then it can predict what you can give. Sometimes it is also predicting this will be the best of medicine you can give. Sometimes it is predicting also the potency also. So I want to share one of my experiences that I am treating a lot of cases of epileptic seizures. That is biggest problem in veterinary side. So I have come across one case in which I'm giving for that purpose this Cuprum metallicum and belladonna. The case was like that. Okay, so the animal start responding. Earlier I was giving 30 potency, and the case comes with 2 seizures for 3 minutes each, twice a week. This was when I started the case. Then started giving this treatment, and after giving treatment for 1 year, I reduce the seizures from 2 per week to 2 seizures per month. Then ultimately I started raise the potency. I make the 200 potencies because it is working well. So I have given the same potency in 200 potencies. And ultimately in 1.5 years, I make the animal stable. And it comes now 2 times in 3 months. Okay. But after this, it doesn't respond anything. I have tried to give so many things, but it doesn't come in under my willingness, you can say like that. So in the meantime, I have taken admission in IISc Bangalore, that is Indian Institute of Science Bangalore. So I asked my professor how we can proceed forward. So he said that yes, we can proceed forward. First, you have to put all the previous data in the machine learning. So we have make the machine learn all the data of 1.5 years. At that time, the machine has predicted. Through machine learning, we have applied some models like this linear regression, like this random forest model. So we have tried that model, and through model, we come to know that the machine has suggested if you go with the LF potency, you will get better and better results. And dear friends, this is an astonishing thing that we have started giving LM potency. 0 by 1, we have started with this.
I think there is some network. There is some network problem with the Surjit Singh Makkar sir. Please wait. Please wait. As we all know that homeopathy can do a lot of wonders in veterinary cases. A lot of doctors practicing veterinary medicine, homeopathy for veterinary treatment, and they are getting very good results also. And due to some network problems, sir is not able to attend again, and he's trying to join now. If anyone want to share your experience in this forum in treating veterinary cases, you can raise your hand so that you can speak for the time being. Let me call our guest. Please wait. Yes, as there was some problem in the network and the electricity has went off at Dr. Sujit Singh Makkar is waiting for the network. So as and when the network come back, yes, I will join. So in between, we can make a discussion. If anybody want to participate in the discussion, please raise your hand so that okay. If anyone has the experience of treating with the veterinary medicine, you may please raise your hand so that we can go ahead with the discussion. There is one doctor in Mustafa. He has done wonderful treatment He has done wonderful work in the field of veterinary science. He is the senior surgeon, senior veterinary surgeon in Calicut, and he's doing a lot of successful cases are there with him, and all the cases, all kind of diseases for veterinary, particularly cow, cat, even elephant, all were treated with our medicine. His methodology of giving medicine is just a single dose diluted in water and giving to the animal or his pet, and he has shown so many results, brilliant results in this forum. So if you want to speak, Samsa, you want to speak? Please, if you want to speak, I can. One more request to all of you here in this forum is that since you are joining by without your name, we were not able to know who is the person who is there in this particular laptop or in the phone. So kindly join with your name so that we will be able to understand who is the person talking from the other side. I am inviting Dr. Indrani Bhavatkar to Dr. Vijay Mane, you want to speak?
Sir, if I'm not wrong, can I talk on the home veterinary, some common problems?
Yes,
Okay. Yeah, we're very thankful for giving such a little bit chance because of the electricity. At least some interaction will be there. Actually, sir, even I'm quite fond of pets. I've got around 5 aquariums at my home clinics as well as at my home. I have got those cockatiels and lovebirds. Many a times I get the opportunity to treat them. So, like, I'll say, let you know a case of just
okay,
15.
okay, our guest has
15.
joined now.
Acha, sir, I joined. No problem, sir. We can continue next time. No
Okay,
problem.
we can
Yeah.
make the discussion in the last part itself. Okay. Still. Yes, Dr. Sujit Singh Makkara is back. So we can go ahead with the presentation.
Yeah, so sorry sir, इधर light चला गया था और
No
there is a big
problem.
problem of this you can say
No problem,
इधर
sir.
बरसात हो रहा है sir. There is a heavy rainfall over here.
Oh.
That is creating problem over here. In Punjab, it is today is a big rainfall over here. So
Okay.
this is a problem. So sorry for that.
No problem, sir. No problem, sir. We may continue. These are all in this kind of webinar, sir.
One minute, I will take 1 minute also.
Yes.
So again, a lot of problems are there, है ना?
No problem, sir. You can continue.
So,
The slide is stuck on the first. Please move it. It's not moving. Ah, yes. Then second slide.
so
So the case is
it is okay, sir?
yes, taking the veterinary case. Yes, okay.
Okay. Thank you. So, while we take the case in veterinary science, it is okay, sir. हो गया अब ये चल पड़ेगा. Yes. So, when we take the case, we take into account LACM, that is location, the problems you have decided to treat, etiology, what had happened around the time it stated to be ill. Then we have to take concomitants. Concomitants, as you know very well, these are the symptoms accompanying the main complaint without any pathological relation to the main complaints. So they are now known as the also unreasonable attendants. And the most important thing is modality. What does the animal choose to do, which we assume therefore makes it better, feel better, or not to do. Anything makes it better or worse. That is modality. So every time we have to take into consideration the modality also. So when we take LACM, that is location, etiology, concomitant, and modality into account, we take the case in a better and better way. Okay. So over here again, so when we have a lot of symptoms, then we have to take PQRSU, that is peculiar, cure, rare, strange, uncommon symptom. So sometimes we have to take the constitution of the animal also. We have to take mind symptoms into account also. Then we can found only the totality of the symptoms, and then we can reach to the simillimum. That is the main point. So with the help of artificial intelligence, we are going to find the simillimum in a very, very short time. In few seconds, we will going to find the simillimum. Because there are a lot of artificial intelligence tools which are going to help us in finding the PQRS symptoms and the modalities and the LACM. And when we feed only the symptoms, it processes and it 100% it gives you best and best results. So we are trying in field all the things like artificial intelligence in veterinary homeopathy by selecting some to find the simillimum. Okay. However, you can say that we are also should have the intelligence here. This is human intelligence, how to find the simillimum. Again, in artificial intelligence, we have to apply our human intelligence also. If you say if there's any common person and if there's any Raman and he started working on this artificial intelligence and he will search his right simillimum, no, not possible. You should have the knowledge of total homeopathy, total materia medica, total organon, then total aphorisms. Okay, you should have the full knowledge of every subject. Then you can find only the simillimum. In spite of AI tools, there is a lot of issues also. You can't say without any knowledge of the this materia medica and all the organons and how to give the medicine and how to take the case, we can find the simillimum. No, not possible like that. So this is a human intelligence where we can apply the artificial intelligence. Okay, so that's why I'm not telling you how we are applying artificial intelligence by using our human intelligence. So, so this is how we have to take the case. Straightway I'm coming to the case taking of how we have taken the case. So first of all, these are some of the constitutional remedies on which we are working all together. So this is arsenic kelp. So this is a portrait of a arsenic kelp remedy. So as you know very well, fear of being alone, anxious, fearful, demanding, fussy. This is a very chilly animal, very restlessness. It needs small amount of water every time. So if there is any problem of colds, gastritis, diarrhea, food poisoning. So we have treated so many cases with arsenic alb. Arsenic alb is the most used homeopathic medicine in veterinary science. So dear friends, we have to study arsenic alb in very big way, and it's all prospectives and where to give its keynotes and all these things. But once you have make the portrait, you will come to know that you can apply this arsenic alb in your cases. So if there's any foul diarrhea, foul smelling, in parvovirus, even in distemper. So whenever there is a problem of enteritis, gastritis, any problems of colds, so arsenic alb is there. Okay. So this is Lexis. Lexis is a very common medicine used in veterinary homeopathy because of it is we use in most probably in reproductive disorders. Okay, as you know very well, Lexis is a very suspicious medicine. So any jealousy, snaky, suspiciousness, paranoid, threatening, it is highly emotional. So whenever you enter some stable and you see there are so many horses are standing over there, and when you enter in the stable, you will see that some of the horses will run away from you. And there are some of the horses, some of the mares or one or two mares in a stable, they will come to you. They will hug with you. They are pulsatilla patients. And some of the horses or mares may be there, which will follow you. Which side you are going. And whenever they find, they will kick you. That is suspiciousness. In Lexis patient, there is a big suspiciousness. As you know very well, it is a left-sided remedy. So whenever in our animals, like in cows or buffaloes or in horses, or whatever the case may be, so whenever there is a problem on the left side of the ovary, it may be a follicular cyst, it may be a luteal cyst, the medicine is Lexis. And if the problem is on the right side, like a follicular cyst or on the right side of the ovary, then the medicine is FPs. So this is how we differentiate between the left-sided and right-sided medicines in the veterinary side. So we take into account the left-sided medicines and right-sided medicine. So Lexis is main for the hemorrhages, circulatory disorders, ovarian problems. If there is any skin color is purple color, it works wonders. So Lexis is the basic medicine made from the snakes. Nux vomica. Again, one of the most common used medicine. Over here, you can see the portrait of this Nux vomica. Over you see the horse with its raised tail. This is the main symptom of the Nux vomica in veterinary side. Because ineffectual urging, it never satisfies. It is passing of the dung, passing of the feces. So it always raised its tail. So this is the most common symptom we can find in our animals very easily. So whenever if the tail is raised and it is not allowed being touched, don't touch me, ineffectual urging, nervous problems, it is a very nervous, oversensitive and irritable. So whenever we find these mind symptoms, the medicine is Nux vomica. So if there is any pain like colics in horses, this is the best of the medicines with the digestive problems, colic, cramps, gastritis, any ulcers. It is again a very chilly animal, over indulgence, worse after eating. Note this point again, worse after eating. So this is a very good medicine. So while we take the case and we veterinarians, we veterinary homeopaths around the world, we are taking these things into account. We make the portrait of the animal and we keep in our mind. Yes, always we keep them in the mind of the nux vomica portrait in our mind. Then we can proceed forward, and we, after finding the simillimum, we will proceed forward which medicines to give. Phosphorus. Phosphorus is the medicine, as you know very well, it is center of attention. Our dog or cat needs always a center of attention. Spontaneous, very, very affectionate, open, nothing filtered, ungrounded, tense and nervous. It is very chilly, very thirsty, easily frightened, very sensitive, lot of fears. Yes. So as you know very well, there are, when there is a cracker sound and there is a sound of thunders. So this medicine phosphorus is the right medicine in those cases, and in all the type of hemorrhages, whenever there is a bleeding part of like that. So we use sulfur, this phosphorus. Pulsatilla. The animal is very, very emotional. Again, you see the portrait from here. It is very sweet-natured, gentle and timid, irresolute, wants safety, fussies, love and company, changeable emotions, physical symptoms. So in animals, we find sometimes diarrheas with changing colors. Morning, color is yellow color. In the evening, the color is slightly dark yellow. In the noon, it is again light yellow. So when the color of the diarrhea is changing in a day 2 to 3 times, the right medicine is pulsatilla. And when the animal is very emotional and timid and sweet-natured, think about pulsatilla. So again, a pulsatilla is a very, very common medicine being used in veterinary homeopathy. So if there is any bland, creamy discharges, prefers fresh air, worse for heat, little thirst. So always think of pulsatilla. Sepia, resentful, sluggish, exhausted, apathetic. This is very, very aggressive, irritable. If there are any hormonal painful seasons, irregular seasons, cysts and fibroids. Again, after Lexis and after pulsatilla, CPI is the most common used medicines in veterinary homeopathy, because it is the only medicine which regulates the cycles. There's a lot of issues in the reproductive cycle of all type of our animals. It may be a bitch also, it may be a bear also, it may be any female species of animals. So this is the most preferred medicine, sepia, to make their seasons regular. If there's any cyst and fibroids, this is very nice medicine. And sometimes, according to the mind symptoms, it rejects its own offspring. This is the main point of sepia. Rejects its own offspring. If there are any miscarriages, always think about sepia. Indifferent, hostile, atony, saggy, bloated. So this is the beauty of the sepia. You can, after finding a simillimum, we can give sepia. Okay. Silicia, silica, you can say like that. So runs of litter, lacks stamina, anxious, lacks confidence, very shy. It is again chilly, avoids conflict, can be obstinate. So animals, you can't say it is only in humans to avoid the conflicts. No, it is in best possible in our animals also to avoid a conflict. Emaciated, poor metabolism minerals, failure to thrive. So dear friends, sometimes we have to take the case very, very seriously. Like over here, I have used the terms avoids conflict. Avoids conflict. So a lot of cases are there which we have treated only on the basis of mind symptoms only, and which the animal are not giving these problems. So in order to avoid the conflict, we give Silicia. So I have treated also one case of a bull from which we are taking semen. In our side, we have to take semen twice a week to make our stars and to make our animals for a artificial insemination. So when we proceed forward that, we come to know about one bull who is not who has a problem. It is not cooperating, and it is not giving it is semen. Okay, and it is not it starts with dysfunctions. Okay, when we take the history, we come to know that it is very proudy bull. You can see of that. It always walk in a very in a proudy way. So whenever there is a proudiness, and the best medicine is platina. So dear friends, over here we have given the platina and we have got the best results. So in animals, these all things are there. So we need our mind to apply all these things. So this is better. As a veterinarian, we know how to observe the animal. Okay, so this is the best way how to observe the animal. And after observing the animal, we reach a particular similibum. Sulfur. This is self-centered, high intellect, lazy, lacks perseverance, sulks, peevish, aggravated by heat, since it is a hot animal, dislikes being washed. Note this point. This is the biggest skin remedy. Again, a most common used medicine in veterinary homeopathy. It is something you can say different from arsenical. Arsenical patient always remains to stand. It is a neat animal, arsenical patient. And the sulfur patient it wants to remain always in the mud. It always seeking cold places to sit. So it goes mud every time because it doesn't like being washed also. So it is remain dirty always. You can say like that also because it is a hot animal. So again, we have how do we have a homeopathy approach? So first we take one of the cases because we have wasted today lots of time in interconnections. So I will take one case also. So this is the case of a parrot which comes to me. The owner of 14-month-old parrot called me over phone and told me that the parrot condition had deteriorated and the parrot is ill since 7 days. And with conventional system medicine, they have declared it is a psittacosis case. It is a disease which is known as psittacosis. It is known as also parrot fever, and it is caused by a Chlamydia psittaci. This is a virus, you can say like that. So according to the owner, this parrot has fever earlier. The symptoms observed are discharge from the eyes, difficult breathing, diarrhea at 1 a.m., morning, restlessness is also there, vomiting, lethargy, loss of appetite, depression, and weight loss. But fever didn't subsided and didn't get better after 7 days of treatments with antibiotics, vitamins, and NSAIDs, like that is non-steroid antibiotics. So according to the owner, earlier parrots wants to remain outside cage. Note this point. But after he becomes sick, it doesn't want to come outside cage. So this is a PQRSU symptom. Over here, you can study the mind of our animal, of our bird. Before falling ill, he wants to remain outside the cage. But it is free. It doesn't have any problem. But after now falling ill, it wants to remain inside the cage because it is afraid of coming outside, because it is afraid of that it may be killed. So he after falling ill, he wants to remain inside the cage. So this is a PQRSU symptom. That is a peculiar, rare, strange, uncommon symptom. So this is the beauty of the homeopathy, that after taking this PQ symptom and other problems, we reproduce the case. So this is the symptom, that is PQ symptom. This is often overlooked by the conventional system of medicine, but in our homeopathy science, it is a main mind symptom as observed by our homeopaths. So main, he is afraid of coming outside, maybe fear of death. He is also restlessness. So a main rubric of the case. So we have reproduced the case. This is a parrot. So over here, we have reproduced the case. I'm audible now? Hello?
Yes, everything fine, sir.
Eh?
Everything fine.
Oh,
What
that's
is-
great. That's great. Okay, okay. Thank you. So, dear friends, over here we have taken 8 symptoms into count. First, we have taken mind symptom, that is anxiety, restlessness with, okay, this is veterinary respiratory by me also. Respiratory system, asthmatic, breathing, restlessness with, then going Hassan, mind symptom, fearsome, anxiety, dread, frightened easily, anxious, restlessness, fearsome. Then going Hassan again, thirst, vomiting after. Going Hassan again, nausea and vomiting, inclination to vomit extra. Then again in generalities, we have taken fever in general. So in overall, the medicines comes to, again we have taken mind also aggravation, fever in general, conjunctiva, inflammation, conjunctivitis, acute and subacute catra from boric. Then from wet respiratory, we have taken eyes as conjunctivitis. So we have taken 8 rubrics. Okay. And after finding all these things, we have 22 points. The medicine comes is arsenic calc. Okay. So here we have given the arsenic calc 1 dose, 30C every 2 hours. And on the same day, in the evening, the owner told me over phone that fever disappeared within 5 hours of giving the treatment. Serious swelling and vomiting disappeared. Diarrhea also improved. GI symptoms also improved. And on the next day, we have again continued arsenic calc thrice a day for 2 days. The body temperature was normal. Oral notes improved, energy levels, diarrhea also improved, and GI symptoms also improved. So, dear friends, I mean to say this thing. If we take the totality of these symptoms into account, and if we remain able to find the PQ as a symptom, and ultimately we find the simillimum, so this is the best way to have this treated this our birds and any type of animal. So this is the arsenic portrait of the arsenic. I've already told you. So over here we have given the arsenic, and this is the photograph after treatment. So our patients becomes very, very happy with the homeopathy. And this is owner words. Sir, he is very fine. Now taking foods also very well, and emotion also getting normal. So dear friends, this is how homeopathy works wonders in our cases. Dr. Dinesh, should I take one more case?
Yes, yes, you can go, because since we have lost a lot of time, we can cut short the discussion.
Okay.
Otherwise, if you are ready, we can make a second presentation of the same.
Yeah, I can present one more case also.
On 8th, if you are if you are available, we can go ahead with some more presentation.
Yes,
On
yes, yes.
8th,
Yes, yes. No problem.
So we can close for the time being. We can have a discussion. And
Yes, yes. Yeah, that is better way. Yes, yes.
Yes, yes, yes. So
Sir,
those.
anybody is there? Yes.
Yes, thank you, Dr. Surjit Singh MAKKAR, sir. It's really a very, very good session. And even though there was some interruption due to network failure, you completed the session in a beautiful way. The case of the parrot, you have shown the beauty of homeopathy, how to choose the remedy, how to choose the medicine in that way. That is the most important point. You have also mentioned about you have shown the beauty of the pictures, which itself tell how one can choose the remedy according to the differentiation in Naxomica, pulsatilla, silicea, sulfur, and all remedies. Anyway, Dr. Indrani Bhavatar has a raised hand, so we can go for discussion. Yes, you can talk now.
Yeah, thank you, sir. We actually lost our valuable time because of the electricity problem. Yeah, sir, a simple question is coming to mind in this parrot's case. How did the owner measure the temperature of the parrot? Because this is a common problem for us also, okay, of the birds. How to measure the temperature? The fever came down. How did he measure
Yes,
it?
sorry, we always measure the rectum, per rectum. We
Per
insert
rectum.
the bulb of the thermometer in the rectum of the any patient.
Okay, okay. Because the books have mentioned that the rectal temperature usually is more 1 degree centigrade than the body temperature.
No. In animals, it doesn't. It doesn't like that.
Okay. Okay.
No.
And second, sir, small query was is that we have a good drugs in our materia medica that the urine smells like horse's urine. And we have 3 remedies for that. That is nitric acid first, nitrum carb, artemisia, abstinum. So should we use this offensive urine symptom for all pets or is it only applicable to horses?
Sir, we have to differentiate. As you know very well, you are also a very good homeopath. I know that.
No,
So, sir, every time we have to differentiate between the remedies.
yeah, that is true. That is true.
We ultimately our total aim is to find the simillimum.
Yeah,
Unless
yeah.
and until we don't find the simillimum, no, we are not going to treat anything.
Means for any offensive urine, we should not consider the symptoms as horse's urine because that was in those days mentioned in materia medica. It was there were old days, no, during the training.
Yes, sir. Our always approach is just that we are curing the animal in disease. We are not curing the disease. So this is our main, again, a very fundamental theory of the this Hahnemann. And the other theory which we are applying in our animal is that minimal dose. So we are the only veterinarians around the globe which we are applying this theory of minimal dose. We are giving minimal dose to our only 1 globule in water to our this parrot, and we are giving only 2 to 3 globules in water to our elephant. You see the situation. We are giving the same dose. We are not increasing the dose according to the weight of the animal or according to the size of the animal. So this is over here fundamental law which we are applying, We are applied in so many cases. We are cured thousands of cases of elephants and other species of animals with minimal dose. So that is the beauty of the homeopathy.
Yeah, thank you. You are doing a great job for pets. Thank you, sir.
Yeah, thank you, sir. So nice.
Yes, I would like to add one more point here. If we all know that the horse urine has a separate specific smell, but when the smell of the horse urine is so pungent or so offensive, then we can think of some other remedy like creosote.
Some other remedies, yes, yeah.
Creosote or something like that in the case of
yes. There is a medicine also which has a very that is acidic is also there. Sometimes it is a UVA ursi. UVA ursi is a very good medicine. Kapaiva. We are using a lot of medicine, but according to the simillimum. And with the help of artificial intelligence, we are very particular in finding these, you can say, rare remedies also. So, we should use in the coming time. This is the new technology, that is artificial intelligence.
Yes, sir. How you use this artificial intelligence in these cases? Just to taking the symptoms and then finding the remedy, and then you go to the this artificial intelligence to find which textbook is telling the right remedy, like that.
No, there are a lot of procedures, sir, but actually we have learned completely. I did my advanced course now. So
Yes.
We know how to we have to go with the Python language. We know how to extract the data. So then we predict the data from the previous history, and then we can predict the more and outcomings. So this is a long question. Sometimes I will explain how we are using artificial intelligence in our science. Yes. But definitely it's giving good results. Yeah, it is very sure.
What is your success rate with homeopathy in treating, managing this veterinary science?
Yes, we have gotten a very successful rate. And after we are coming to this, earlier we are using only this 30 potencies and 200 potencies and one arm like that. And nowadays, after this using this artificial intelligence, we are starting using 11 potencies, and we are getting very good results. And our success rates it goes very high. Earlier in parvovirus and in distemper, we are using these normal potencies, but after we have started using LM potency, we are getting very good results. And we repeat over here. We repeat the medicine LM potency. We can repeat after half an hour also. And with the repetition, we are getting better and better results.
Okay, sir. And now it is the time to wind up the session. I invite Dr. Indrani Bhavatkar to say a vote of thanks to the session.
So over here, Gracia is also there. Gracia is also sitting over here. So hello, Gracia.
She can speak in their language, not in Hindi, English, I think.
No, she knows me, sir. She's on my Facebook also. She's everywhere with me.
Okay, then
Yeah.
you can speak.
Yeah, you can unmute.
Please unmute. Please unmute. Please unmute.
Yes. Hello, Gracia.
Graciela, Anabela, ¿me podés traducir?
Okay.
Okay. ¿Me podés traducir? Bueno,
Okay.
Gracias. La verdad que
Gracia.
gracias.
Yes, thank you.
Ya nos vamos a encontrar, ¿eh? Ya nos vamos a encontrar.
Okay, thank you. Thank you. So other friends are also there. Thank you. So Alma is there, this Anbo is there. So all my dear friends, thank you so much for listening me. Thank you. I'm grateful to you all people. Thank you.
There's a formal vote of thanks here, sir. That's why
Yeah. Sir, actually, on behalf of all IFPH team, we all are really thankful to have a great person like you. Like you're doing really a good job to help with all the innocent pets. Actually, we would request you, sir, when time permits, you can again present one more lecture to us.
Yes, yeah, I will. No problem. I will.
To you. Yeah, and your presentation was very simple and it was quite helpful to us. Hope we again meet in future. So we are very thankful for your presentation, sir. From the point of yeah, welcome, sir. Yeah.
Thank you, sir. Thank you. So nice.
Thank you, Dr. Indrani.
So thank you, everybody. Thank you. So nice of you. Thank you.
Thank you, Dr. SURJIT, and those who attend the session. Tomorrow we will have a session from Dr. Kulwant Singh sir, and so we'll be talking about rheumatic fever, heart, and its homeopathic management. With that, we come to the end of the day 1645. Thank you all. Good night.
Thank you, sir. Thank you. Okay,
Thank
bye.
Now, it's over to Dr. Mariamma John to moderate the Malayalam session. Unmute it. Please unmute. Please unmute.
നന്ദി ധനേഷ് ഡോക്ടറെ. എല്ലാവർക്കും നമസ്കാരം.